integumentary system within the pediatric population. So, eczema or dermatitis. So, it's a superficial inflammatory process. There's many different types. You have atopic dermatitis, contact dermatitis, you have stasis dermatitis. There's also infantile, childhood, and pre-adolescent or adolescent dermatitis. So the goal of dermatitis treatment is to relieve itching, lubricate the skin, reduce inflammation, and prevent or control secondary infections. This patient is going to present with itching, a lot of redness, scaliness, and then weeping, oozing, or crusting of lesions can occur as well. Interventions, very important to know. So baths and moisturizers are very important. The bathing water should be lukewarm and limited to 5 to 10 minutes. You want to avoid hot water because hot water will just dry the skin out further. You want to moisturize the skin immediately following the bath using a very thick cream or ointment. You want to avoid exposure to any skin irritants such as soaps, detergents, powder, or wipes. Prevent scratching in an attempt to prevent any secondary infections. And then, of course, you want to monitor the lesions for infection. So signs of infection would be a honey-colored crust with surrounding erythema. So impetigo. Impetigo is a contagious bacterial infection of the skin. It commonly occurs in hot, humid months, most commonly on the face, around the mouth, or on the hands, neck, or extremities. So these lesions will begin as a vesicle or pustule surrounded by erythema, and then it progresses into an exudative and crusting stage, which then results in honey-colored crust with ulcerated bases. Now, impetigo is highly contagious, so this patient will be placed on contact isolation, and then topical antibiotic ointments will be prescribed for treatment. The patient will remain contagious until 24 to 48 hours after initiation of the antibiotic treatment. You definitely want to use careful hand washing to prevent any spread of the infection, and then the infected patient should use separate towels, separate dishes, separate linens. You also want to wash their linens separately from other linens as well to prevent transmission of the bacteria. Okay, so lice or pediculosis capitis. This child is going to scratch their scalp excessively. You may observe nits or white eggs on the hair shaft of the child. Adult lice are more difficult to see. They're going to be like tan or grayish specks, and they crawl quickly, which makes my head itch just thinking about it. So the female lice are going to lay her eggs on the hair shaft close to the scalp. The incubation period is 7 to 10 days. It is transmitted by direct or indirect contact with the sharing of brushes, the sharing of hats, or bedding. Most lice products cannot be used in children younger than 6 months of age, so definitely follow the package directions. Any hairbrushes or combs need to be thrown away, or you can soak them in boiling water for about 10 minutes. And then any bedding used 2 days prior to the diagnosis needs to be washed in hot water and then dried on hot for at least 20 minutes. Any non-essential bedding or clothing can be stored in a tightly sealed plastic bag for up to 2 weeks and then washed. Okay, scabies. Scabies is a parasitic skin disorder caused by an infestation of scabi. It is most common among children and those institutionalized due to close contact. So it is transmitted by close personal contact with the infected person. All household members and contacts of the infected child need to be treated simultaneously. This patient is going to present with a very itchy papular rash. Also, very characteristic of scabies, they're going to have burrows into the skin, which present as fine grayish red lines. Definitely remember that. So, a prescription is going to be needed for scabies treatment. So one type, Lindane shampoo, it should not be used in children younger than 2 years of age. If it is, there's an increased risk for neurotoxicity and seizures. Scabicide should only be applied to the neck down. You never want to apply it to the face or the head. Another type of treatment is permethrin. It's applied to dry skin 30 minutes after bathing. You apply it to all surfaces, so not just those with a rash. You apply it to all surfaces. You leave it on for 8 to 14 hours, and then you remove it by bathing. And then in a patient with scabies, all bedding, clothing, etc., it needs to be washed, dried, and ironed before reuse. You want to continue that process for up to 1 week. Okay, so burn injuries. Very young children who have been severely burned have a higher mortality rate in comparison to older children and adults with the same burns. So they have an increased risk for fluid and heat loss, dehydration, and metabolic acidosis. So a young child's skin is thinner, meaning that lower burn temperatures and shorter exposure to heat can cause a more severe burn. So burns greater than 10% of the body surface area require fluid resuscitation. In pediatrics, the extent of the burn is expressed as a percentage of the total body surface area. So fluid replacement is often necessary 24 hours after the injury because of the fluid shifts that will occur. So it's very important to know what I'm about to say next. So you're going to want to monitor the vital signs, monitor their urine output, monitor the capillary refill, and mentation to determine adequacy of fluid resuscitation.